Hey everybody, I've been asked to make a video on what my post-transplant regimen looks like in terms of medication. I have in front of me all the drugs that I'm on right now, and I'm going to go through them one by one and just tell you a little bit about what each one actually does. The first drug that I'm going to talk about is called tacrolimus. Now tacrolimus is very important because it's an anti-rejection medication. And during the first several weeks post-transplant, I have to have labs drawn twice a week so they can fine-tune the amount of this dose. And what they're looking for is how much tacrolimus is left in your system after 12 hours, because you take all of your medications exactly 12 hours apart, or as close as you can get to that. So if at the end of that 12 hours, when my lab is drawn, if my tacrolimus level is too low, they'll bump it up by maybe a half milligram or a milligram, and we'll look at the next set of labs and see how that did for me. So I started out at 3 milligrams and I ended up at 6 after multiple lab tests. So I have to take this one twice a day, and I take 6 capsules in the morning and 6 capsules at night. So these medications are going to add up, as you'll see. The second one is prednisone, and with prednisone I started out on 30 milligrams. And I tapered down over the period of several days from 30 to 20 to 15, 10, and then finally 5, which I'm on now. Prednisone will give you a lot of problems with sleeping, and I did experience that. And I oftentimes felt a little wired. You know, even though I really felt tired and felt like I could sleep, I just could not shut my mind off. And prednisone, did cause me problems, but it has gotten better since I got down to 5 milligrams. The next anti-rejection medication, which is also taken twice a day, is mycophenolate. And again, this is just responsible for suppressing your immune system so it does not attack that kidney that wasn't native to your body in the first place. So I'll be on these 3 for the rest of my life. Now, I have 3 other meds that I'll be taking for the next 3 to 6 months. And the first one of these is famotidine, which you might know as Pepcid. And this is designed to help my stomach out with all of these new drugs that I'm taking, because they add up really fast. I mean, I'm probably taking, 30 to 40 pills a day, and my stomach seems to be tolerating it okay, and it's probably because I'm taking this Pepcid. The next one is called acyclovir. It's very important post-surgery because your immune system is suppressed now. The final one is sulfonylurea, and that's basically designed to help prevent any bacterial infections that you might encounter. Again, you're immunosuppressed, so this is a very important drug post-surgery. And I'll probably be on these 3 for anywhere from 3 to 6 months. I'm guessing I'll probably be able to drop the Pepcid first, because I've been able to tolerate medications. I've been taking medication my whole life, so not really a big deal to me. Now, the last set of medications that I'm dealing with right now is because my kidney is actually working too well, and it's taking some stuff out of my blood that it really shouldn't be in the amount that it is. That will eventually even itself out, and I won't have to take these, but for now, I do. Now, the first one of these is just simple magnesium. You can get it over the counter if you want to, but I just decided to make that part of my pharmaceutical medication regimen. And I take 2 tablets twice a day. And again, that's just designed to help me get my magnesium level up a little bit. My lab tests have shown that that's a little low. The second one is a phosphorus supplement. This phosphorus supplement was necessary for me because my phosphorus was always low, and that's really not a good thing to be low on. It can cause a lot of problems for you. So I'm currently taking 2 of these in the morning and 2 at night. And my labs have shown that my phosphorus has come into line, so it might come to the point where I'm able to just go ahead and supplement using food. Like, I've been eating a lot of what they call sun butter, which is sunflower, a peanut butter replacement. It's actually not that bad, really, and I've been having it on toast and everything. And a tablespoon of that equals to almost 2 of these pills, so I'll probably end up going that route, just to eliminate a few pills a day. That would be 4 pills a day that I could take out of my regimen. And then finally, this is just a post-transplant multivitamin. It's designed to help out kidney patients because things are still kind of getting themselves into line. So the next thing we have to talk about then is, how do I manage all these medications? Because there are some other ones that I take as well that I'm not going to discuss in this video. But what I have here is my nice pill case. So I've got Sunday through Saturday, and if I pull one of these out, I'll just pull out my Sunday, you'll see that I've got this full for my morning and evening dose. There's a few more pills in the morning because some of these are just once a day, and there's fewer at night. Honestly, they feel the same. It's just a lot of pills, and I found it easiest to just take like a protein shake to get these down, because it makes your throat really slippery and things go down a lot easier than with water, because some of these can get stuck in your throat and it's not really a good feeling. So basically every Tuesday I sit down with all these bottles plus my other medications. I open up all these cases, the morning and evening compartments, and I fill them one by one for the entire week. So it makes it really easy. The only thing that I have to remember to do, it's easiest to take the morning dose because I just take it, at 8 o'clock when I'm making breakfast or whatever. But I always make sure I have that day's dose with me, like in my coat pocket or whatever, because I am being very, very strict about timing with this. I want to make sure that I am taking these exactly 12 hours apart. I don't ever want to lapse on that. If you miss a dose, your kidney's going to take a little bit of a hit, and you don't want that. You want your kidney to last as long as it can. So I always have this with me in case I'm out doing something somewhere, and when that 8 o'clock p.m. arrives, I take it no matter where I'm at, because it's always with me. I do advise, and I've done this myself because it's very valuable to do so, I set a daily alarm to tell me when to take my morning dose and when to take my evening dose. And it's worked out well, because sometimes you can be busy doing something, even watching TV, and you don't realize what time it is. So that phone alarm really, really helps me. I recommend that anybody do that. The more you can stay on top of the timing of your medications, the better off you're going to be. So I hope that gives you a little insight into what the post-transplant medication regimen looks like. It does look like a lot, and it is, but again, these will go away, and these two will go away. So I'll just be left with these 4 medications ongoing, in addition to all my other medications for cystic fibrosis. So with that said, I wish you all good health, and stay tuned for another video. Thanks.